In the sprawling slums of 19th-century London, where infectious diseases killed more people than wars and 1 in every 2 children died before their 5th birthday, a nurse returning from the Crimean War began implementing a revolutionary system of hygiene and patient care that would save more lives than any medical breakthrough of her era, reducing hospital mortality rates from 42% to just 2% through practices that seemed almost magical to her contemporaries yet were based on meticulous observation and scientific reasoning that established the foundations of modern nursing. Her innovations in sanitation, statistical analysis of medical data, and patient-centered care transformed healthcare worldwide. Yet today most people cannot name her, and those who recognize her name know only simplified myths that obscure her actual revolutionary contributions to medicine, public health, and the very concept of evidence-based practice. This is the story of Florence Nightingale, the woman who saved millions of lives through radical reforms in hospital care and public health, whose brilliance in statistics and epidemiology matched her compassion for the sick, yet whose legacy has been reduced to the image of a gentle lady with a lamp rather than the fierce reformer and pioneering data scientist she actually was. Born on May 12, 1820, in Florence, Italy, to a wealthy English family, Florence Nightingale seemed destined for a life of privileged leisure, educated in classics, mathematics, and philosophy by her father, who believed daughters deserved intellectual development despite Victorian society's expectations that upper-class women should focus solely on marriage and social duties. From her earliest years, Florence demonstrated both compassionate concern for suffering and an analytical mind that sought systematic solutions to problems she observed in the world around her. At age 17, she experienced what she described as a divine calling to serve God through nursing, a profession considered completely unsuitable for respectable women in Victorian England, where nurses were typically viewed as little better than prostitutes, often drunk, untrained, and working in squalid conditions that no lady would endure. Her family was horrified by her ambitions, as wealthy women were expected to marry advantageously and manage households, not work in hospitals filled with disease, poverty, and moral corruption. Florence rejected multiple marriage proposals, including from a man she loved deeply, because marriage would prevent her from pursuing her calling to reform healthcare. For years, her family blocked her nursing aspirations, but Florence used this forced delay to study everything she could about hospitals, medical care, and public health systems across Europe, traveling to facilities in France, Germany, and elsewhere, taking detailed notes about what worked and what failed, building theoretical knowledge that would later inform her revolutionary reforms. In 1851, at age 31, she finally convinced her family to allow her to train at the Institute of Protestant Deaconesses in Kaiserswerth, Germany, one of the few respectable nursing training programs in existence. She returned to England and took a position managing a small hospital for gentlewomen in London, where she began implementing organizational reforms that improved patient care while reducing costs, demonstrating administrative abilities that would soon prove crucial to her greatest achievements. The opportunity that would define her legacy came in 1854 when Britain entered the Crimean War against Russia, and reports began reaching London describing horrific conditions in military hospitals where wounded soldiers were dying not from their injuries but from infections, neglect, and appalling sanitation. The British public was outraged by newspaper accounts of wounded men lying in their own filth, surrounded by rats, with no proper medical care, while the military establishment seemed indifferent to their suffering. Florence Nightingale leveraged her social connections and growing reputation to convince the government to send her and a team of 38 nurses to the Scutari Barracks Hospital in Turkey, where the worst conditions existed. What she found upon arrival was worse than reports had suggested: a massive facility housing thousands of wounded soldiers in conditions of unimaginable squalor. The hospital had been built over a massive cesspool, contaminating the water supply. The building was infested with rats and fleas, linens were never washed, and basic hygiene practices were completely absent. Wounded soldiers lay on floors in their own waste, infections spread unchecked, and mortality rates reached 42%. Meaning nearly half of all soldiers admitted died, most from preventable diseases rather than their battle wounds. Florence Nightingale did not simply offer comfort to dying men, though her nightly rounds with a lamp checking on patients created the romantic image that would later overshadow her real accomplishments. Instead, she launched a systematic campaign to revolutionize every aspect of hospital operations, fighting military bureaucracy and medical establishment resistance at every step. If these stories of brilliant reformers whose data-driven innovations saved countless lives yet whose contributions remain underappreciated inspire you to discover more hidden pioneers of modern medicine and public health, consider subscribing to Hidden Minds and activating the notification bell to explore extraordinary individuals whose genius transformed our world. She organized the scrubbing and disinfection of the entire facility, established laundry services to ensure clean linens, improved ventilation to reduce airborne infections, reformed the kitchen to provide nutritious food instead of the rotten provisions previously served, and implemented strict protocols for waste disposal and personal hygiene. Most revolutionary, she began collecting detailed statistical data on mortality rates, causes of death, and patient outcomes, applying the mathematical education her father had provided to create visual representations of data that made her findings impossible to ignore. Nightingale invented the polar area diagram, also called the Rose diagram or coxcomb chart, a sophisticated data visualization method that showed at a glance how soldiers were dying primarily from preventable diseases rather than battle wounds. Her charts proved that improved sanitation and nursing care were more effective than medical treatment in saving lives, a shocking revelation that challenged prevailing medical assumptions and demonstrated the power of hygiene in preventing death. Within 6 months of implementing her reforms, mortality rates at Scutari dropped from 42% to just 2%, one of the most dramatic improvements in medical outcomes ever recorded, saving thousands of lives through systematic application of cleanliness, organization, and data-driven decision-making. Nightingale returned to England in 1856 as a national heroine, though the physical and mental strain of her work had permanently damaged her health, leaving her largely bedridden for much of her remaining 54 years. Far from retreating into invalid status, she used her fame and connections to launch ambitious campaigns for healthcare reform, working from her bedroom to produce detailed reports, lobby politicians, and influence policy at the highest levels of government. In 1859, she published Notes on Nursing, a groundbreaking book that became the foundational text for professional nursing education, emphasizing that nursing required both compassionate care and rigorous training in hygiene, observation, and medical knowledge. The book sold exceptionally well and was translated into multiple languages, establishing nursing as a respectable profession requiring specific expertise rather than merely unskilled labor performed by desperate women. Her greatest influence came through her statistical work and policy recommendations that transformed public health across the British Empire and beyond. She produced massive reports analysing sanitary conditions in military barracks, civilian hospitals, and urban slums, using statistical evidence to prove that disease was primarily caused by environmental conditions rather than individual moral failings, a revolutionary concept that challenged Victorian assumptions about poverty and illness. Nightingale's statistical innovations were decades ahead of their time, as she essentially pioneered the use of data visualization in public policy, creating charts and graphs that made complex medical statistics comprehensible to politicians and the public. Her work influenced the design of hospitals worldwide, establishing principles of ventilation, natural light, proper spacing between beds, and sanitation systems that became standard in modern healthcare facilities. She corresponded with reformers across the world, advising on hospital design in India, Australia, Canada, and throughout Europe, her influence extending far beyond Britain despite rarely leaving her bedroom after returning from Crimea. In 1860, she established the Nightingale Training School for nurses at St Thomas's Hospital in London, using funds raised through public subscription to create the first professional nursing education program based on systematic instruction rather than mere apprenticeship. The Nightingale School's graduates carried her methods worldwide, establishing nursing schools and reforming hospital care across Europe, America, and the colonies, multiplying her impact far beyond what she could have achieved individually. Nightingale's influence on public health policy was equally transformative, as she served as advisor to the government on sanitary reforms in India, where mortality rates among British soldiers were astronomical due to poor living conditions. Her detailed analysis and recommendations led to comprehensive reforms in water supply, sewage systems, and barracks design that saved countless lives among both military personnel and civilian populations. She advocated for improved housing for the poor, better nutrition, access to clean water, and educational programs about hygiene, recognizing that health depended on social conditions as much as medical treatment. Despite her enormous influence during her lifetime, including being the first woman elected to the Royal Statistical Society and receiving numerous honors from governments worldwide, Florence Nightingale's actual contributions became obscured by sentimental mythology after her death. The image of the lady with the lamp, wandering through wards, offering comfort to suffering soldiers, became the dominant representation, a narrative that emphasized feminine compassion while erasing her revolutionary work in statistics, policy, and systematic reform. This sanitized version made her safe and inspirational, a figure who challenged gender norms by caring for others rather than through intellectual brilliance and fierce bureaucratic battles against entrenched interests. The myth obscured that she was a pioneering data scientist who used statistics to prove her theories, a ruthless administrator who fought military officials to implement reforms, and a brilliant writer whose reports influenced policy at the highest levels of government. Florence Nightingale died on August 13, 1910, at age 90, having spent over half a century as an invalid who nevertheless revolutionized healthcare, nursing education, hospital design, and public health policy from her bedroom through sheer force of intellect and will. She was offered burial in Westminster Abbey but requested a family funeral instead, characteristically avoiding the public recognition that might have ensured her actual achievements were properly remembered rather than reduced to comforting myths. The complexity of properly assessing Nightingale's legacy lies partly in the fact that her innovations became so universally adopted that they seem obvious in retrospect. Modern hospitals with proper ventilation, clean linens, trained nurses, and systematic hygiene protocols embody her visions so completely that we forget these practices once seemed radical and were implemented only through her evidence-based advocacy. Her statistical methods for analyzing medical outcomes became foundational to epidemiology and public health research, yet are rarely attributed to her specifically because they were so widely adopted and built upon by later researchers. Contemporary scholarship has begun recovering the full scope of Nightingale's intellectual contributions, recognizing her as a pioneer in data visualization, a founder of evidence-based healthcare policy, and one of the most influential public health reformers in history. Her polar area diagrams preceded modern infographics by over a century. Her systematic collection and analysis of medical data established protocols still used in clinical research, and her holistic understanding of health as dependent on environmental and social conditions anticipated contemporary public health approaches. The tragedy is that generations of women inspired by simplified myths of Nightingale as a gentle caregiver never learned about her statistical brilliance, her fierce advocacy, or her systematic approach to reform. How many potential data scientists and policy reformers were steered toward caring professions alone because they did not know that their heroine was fundamentally a brilliant analyst who used rigorous evidence to transform systems rather than simply comforting individuals. Today, as we face challenges of hospital-acquired infections, healthcare system reform, and the need for evidence-based policy, Nightingale's methods remain remarkably relevant. Her insistence on collecting and analyzing data before implementing reforms, her understanding that environmental conditions determine health outcomes, and her systematic approach to improving complex systems offer blueprints for contemporary healthcare challenges. Florence Nightingale saved millions of lives not through dramatic medical breakthroughs but through the unglamorous work of improving sanitation, training nurses, collecting statistics, and fighting bureaucratic resistance to reform. Her legacy demonstrates that the greatest contributions to human welfare often come not from individual genius moments but from systematic application of observation, analysis, and evidence-based advocacy that transforms entire systems. History forgot her actual achievements, remembering instead a comforting myth of feminine compassion that obscured the fierce intellect and revolutionary impact of a woman who fundamentally transformed how we care for the sick and understand the social determinants of health. Perhaps the greatest tribute we can offer Florence Nightingale is to remember not just the lady with the lamp, but the brilliant statistician with the data, the fierce reformer with the pen, and the systematic thinker whose evidence-based advocacy established the foundations of modern healthcare and saved millions of lives across generations.